In this video, we're talking about chronic kidney disease in cats. We're going to discuss the treatment options and monitoring of chronic kidney disease. As part of this, we're going to talk about the 5 key things that your vet should be monitoring in your cat with kidney disease. And then at the end, I have a bonus 6th thing to monitor in cats with chronic kidney disease that is often overlooked. Treatment options for your cat with kidney disease really depend on how your cat feels, and they're also based on the results of urine and blood testing and blood pressure testing, which we're going to discuss in a minute. Kidney disease is diagnosed using creatinine in cats, but there is no treatment for high creatinine. So while this is used to diagnose the disease, it is not helpful for treatment. It can be helpful to see how the disease is progressing, so it is still useful to test and to monitor, but it is not the most useful thing to keep testing, so it is not included in my list of 5 monitoring tests. When treating kidney disease, we want to focus our effort and our budget on treating things that will help to make your cat feel better and will slow down the progression of the disease. And it also makes sense to focus our efforts on things we can actually treat and do something about. There are 5 main things to focus on. The first extremely important thing to test for and monitor in cats with chronic kidney disease is blood pressure. Chronic kidney disease predisposes your cat to high blood pressure. In humans, we often refer to high blood pressure as the silent killer, and in cats it is no different. Having high blood pressure can have some very serious and life-threatening consequences for your cat. I recommend that you watch my video on high blood pressure for more information. Cats with chronic kidney disease should have their blood pressure checked every 3 to 6 months to make sure that it is not high. And if your vet finds that your cat does have high blood pressure, it is very treatable with medication. The second important thing to monitor in your cat with chronic kidney disease is their red blood cell count, as cats with chronic kidney disease can become anemic. This usually happens as the disease progresses, and it is more of a feature of advanced chronic kidney disease, but it can happen early on too, so it is worth monitoring. The reason cats with chronic kidney disease can become anemic is that the kidneys are responsible for making a protein called erythropoietin that controls how many red blood cells your cat makes. In chronic kidney disease, the level of erythropoietin can drop, and the result is anemia. And again, there is a very effective treatment for cats who are anemic for this reason. It involves regular injections with a drug that mimics their own erythropoietin. And again, I suggest monitoring every 3 to 6 months to make sure that your cat is not anemic. The third thing to monitor in cats with chronic kidney disease is phosphorus. Phosphorus is measured in a blood test. Phosphorus can be high in kidney disease because the kidneys are usually responsible for clearing it, but in chronic kidney disease they may be less effective at clearing it. Phosphorus can negatively affect how your cat feels, and it can also contribute to progression of your cat's kidney disease and make the disease worse. So controlling phosphorus is important. We have 2 ways to reduce phosphorus. One is the use of phosphate binders, which will bind phosphorus in your cat's food so they do not absorb it in their intestine. And the other way to reduce phosphorus is the use of kidney food or renal food. Kidney food is designed to be lower in phosphorus, and that is one of the things that makes it kidney food. Phosphorus should also be monitored every 3 to 6 months. The fourth thing that we should monitor in cats with chronic kidney disease is potassium. Potassium is also measured using a blood test, and in contrast with phosphorus, potassium can be low in chronic kidney disease because it is lost through the kidneys when cats drink and urinate more. Potassium is very important for a variety of functions in the body, including muscle function, and cats who have low potassium can feel weak, so it is really important to make sure that this is not happening. And there is also some evidence to suggest that low potassium may contribute to the progression of kidney disease. Potassium can be easily supplemented in the diet, so it is definitely worth monitoring. And again, I recommend monitoring potassium every 3 to 6 months. The fifth thing that we want to monitor in cats with chronic kidney disease is the amount of protein in their urine. One of the major functions of the kidneys is filtering blood, which contains protein. Most proteins should not be filtered into the urine, but in chronic kidney disease, the filtration system is not as effective as it should be, and so some protein can end up in the urine. We do not want this to happen for a couple of reasons. First, protein is super valuable, and we want to make sure that it is being used for building muscle and for essential body functions, and not ending up in the litter tray. And then secondly, protein filtered through the kidneys as urine is being produced may cause damage to the kidneys, so it can contribute to the progression of chronic kidney disease. We can test for it using a urine sample, and we do have effective medications that can treat excess protein in the urine. And again, I recommend testing every 3 to 6 months. Many cat owners worry about getting a urine sample from their cat, but don't worry, we can do this by taking urine directly from the bladder with a needle in the consult room. This is a very routine procedure that we do every day. There is a sixth thing to monitor for. I'm going to briefly mention it here, but you can also check out my video on urinary tract infections in cats for more information. Cats with chronic kidney disease are also at increased risk of urinary tract infections, which is a bacterial infection in the bladder. Female cats in particular are at risk, so this is something that should also be screened for. Your vet can do this by looking at urine under the microscope for any evidence of infection and then culturing the urine if they are suspicious of an infection. And I suggest doing this when urine is taken to check for protein. Other treatments can be used in cats with chronic kidney disease, and these really depend on how your cat feels. Many cats can feel nauseated due to the increase in creatinine, and for these cats we can use anti-nausea medication. This is usually a tablet that is given once daily. I want to briefly talk to those people who cannot monitor or treat their cat for whatever reason. It may be due to cost, or you may be unable to get your cat to take medication, or your cat may be aggressive and you may decide that you do not want to bring them to the vet for regular monitoring because it's too stressful. Sometimes we all make that choice as cat owners. It certainly does not make you a bad person or a bad cat owner. As long as your cat has a good quality of life, that is the most important thing. The purpose of detailing the monitoring and treatment options is not to make you feel bad about what you cannot do, it is to provide you with the information to give you a choice on what you can do. There is so much to talk about with chronic kidney disease in cats, and we have barely scratched the surface. But really, these are the 6 most important things to monitor in your cat to make sure that your cat feels as well as possible for as long as possible, and to help slow down the progression of kidney disease. I really encourage you to check out the International Renal Interest Society's website for more information on this subject, and I've provided that website for you on my website. If you have topics that you would like to see a video on, please let me know and I will be happy to make them for you. See you in the next video.